Good afternoon, Tiankai. First, welcome to this conversation, and I'm very grateful that you could share your experience with different healthcare product, especially the CGM. So first, would you please introduce yourself? Thank you.
Uh, Hi, my name is Tian Kai. My role is a UX designer in a healthcare company. I used to work on some kind of healthcare SaaS project. The main goal is just to integrate different aspects of the patient, for example, their blood glucose or blood pressure, their height, weight, their heart monitoring to give a comprehensive understanding of a patient and also give a comprehensive care plan. So we are and I have a little bit of experience to build the CGM feature into that platform.
So today we're gonna focus on the user experience of the continuous glucose monitoring. So first, could you please share a general experience and steps that your users using the CGM device?
So okay, so I think the first step is always prescription. CGM, although most of the time, you can right now buy out of the shelf in I think most of the state in the US. But in our platform at least, most of the patient were prescribed by their doctors, and so they basically get identified as a diabetic or pre-diabetic diabetic patient, and then they were identified, prescribed. That's the first step, and in that step, the next part is basically enrollment. Um, Basically, that's when the patient received the CGM device, and the on the healthcare provider side, they need to give enrollment. They need to enroll this patient into our system to activate basically this type of data in the profile. So that's the second part, enrollment, and then next part is onboarding. Onboarding means user receive the device, they unbox it, and then they pair this device with smartphone apps. That's basically onboarding. And also another part after unboxing and pairing is set up the monitoring. That's pretty iconic step of having a I think what that called, it's called CGM installation base on your on your arm, and then uh, insert a little stream in your body. That's how you collect continuous glucose. So basically, step two is onboarding, which include unboxing and then pair device. Also, uh, set up the device uh, on the patient arm. So the next step is basically just continuous monitoring. Depends on the prescription. It can be like 7 days, 14 days, sometimes 30 days. Um, that's just continuously patient will get data on their apps, and they will sometimes they will include their caregivers, for example, their partners, their mm, parents, or their children, and to also receive alarms in the continuous monitoring phase. In this phase, also patient will sometimes get flags and alarms. Flags and basic alarms, basically, they are rule based, right? So it's like if your blood glucose has continuously higher than a certain threshold, then we'll give you a flag. and that flag basically communicate both ways. It's to patient and means alarm on their side, and it's also an alarm on the professional caregiver side. This on the patient side most of the time means a notification from the app. If it's a very important one or a very urgent one, sometimes the caregiver would really interrupt and send messages or even call the patient for the emergency case. So that's the continuous monitoring phase. Sometimes depends on the prescription, and on the patient's will. We could involve coaching. Coaching is basically we have a check-in. The health coach or their doctors can check in with a patient. That basically includes, for example, every week they have a 15 minutes check-in to talk about how the patient feel and do they have any questions on the CGM device? Do they have any feedback on this? And what's their daily life really looks like recently? Probably sometimes the healthcare professionals would ask a few questions. Sometimes they would ask the patient to explain what happened during a certain period of time so that they can kind of know why the data looks like that way in the past few days. So that's basically continuous monitoring. After that, basically, it's the offboarding. Offboarding is less of a problem for patient. It's just take off the device and then return it or throw it away, depends on the device itself and the reimbursement model. Also, but then on the healthcare professional side, that basically means report. They need to generate a comprehensive report of that patient during a certain time period and provide the analysis to the doctors who will give like diagnosis or even healthcare suggestions in the future. So that's basically a pretty comprehensive journey of any CGM users from what I can tell.
So you mentioned that there's a lot of steps that user will have to involve during the whole period. So what are the biggest challenges or the pain points that the user face when they are using the blood glucose monitoring? This can be related to the device or to the supplies or to any of the supporting services. What are the challenges that you think are the biggest for your users?
So I think generally the biggest problem is of course onboarding, but I mean different patients have different concerns or problems with onboarding. For example, some patients just feel like it's going to be painful, or like they can be worried about if they can wear it for swimming or bathing or to the airport. They worry about those things and become really resistant during their healthcare visit. So that's one type of problem with onboarding. There are, of course, other types of problem because, for example, it can a lot of times we use like mail to patient model or even patient pickup. Basically, patient will get the box themselves, and then they need to unbox it and figure out what to do with the device. They most of the time they would just call their doctors, which is really not the most effective way. They should be able to call the either the device manufacturer or us as a platform. I can explain later why we are here, but yeah, that's basically about unboxing and getting get understanding of what to do with this device and then how to collect a baseline for that. Sorry, so I use a term here. So basically, we call it the problem of unboxing to baseline collection. So it's basically from the patient receives that box to the collective first valid data point. We call it baseline, right? So that's a very challenging period of time. A lot of patient tends to just call their doctors during that time without even trying themselves. Um, or they would, even worse, they would just give up and put the box in the shelf for a few days until we call them. That's even worse. So there's a few cases. So, but I mean, other problems, of course, can be uh, alarm fatigue. Um, we, I think, in designing those products, we try to really avoid that by giving priorities to different kind of alarms. As I said, um, there are many different flags that a person can trigger, right? If they eat too fast, they can trigger a flag. If they just eat a like very sugar drink, then that will also cause a flag. But um, the flag has different emergency level. If you always send alarms for every kind of flag, patient and of course at the end of the day, the healthcare professionals would both just try to neglect and not responding to any of the alarms. So I would say very challenging part about the continuous monitoring phase would be uh, how to effectively communicate the most critical flags and then the alarms they triggered, but also, still keep communicating and recording those not so critically important flags at the back of the pocket. That's I would say the most important thing.
Hmm. Thank you for sharing the challenges that your user will face during the entire process. And you mentioned that for the design part, you will use different alarming systems to prevent alarm fatigue. So apart from this, is there any other things that design contributed so as to like help the user to have a better user experience or to tackle the challenges that user have to face?
Uh, I would say it's I mean, I am a UX designer, mostly, face focusing on the UI design. Of course, in Screen you can do what you can, right? So, for example, as I said, the alarming systems to really have a meaningful logic of different types of alarms and then prioritize them and only send push notifications when you absolutely need to. Um, and if I mean for the onboarding part, actually, what I said, there's a lot can be done outside of the screen. For example, what I said on the from unboxing to baseline collection, right? So that's basically if you can design the packaging really well, if you can give clear instructions and very warm welcome, and also just calm the patients down a little bit. That would also be really helpful and give really clear instructions on, for example, what's the step 1, 2, 3 to do, right? So step one, just focus on the sensor itself. Okay, don't think about anything else. Just focus on the sensor, and you can just unbox that sensor and put it on where it should be. And yeah, if they can do that, good, good. Congrats them and then calm them down, and also then give them like step two, right? You can do a lot of like packaging tricks, like give them different levels of package inside like a one big box. So or give them use like really clear instructions or really cute illustrations, that will also help. Basically, I think design here is really a broad way of communication and to effectively persuade and calm user down from panicking or run away from this challenge of using this device.
Thank you so much for sharing the general user experience and the challenges that users have to face. Also, thanks for sharing the what the design can do to a better user experience. So I guess that's all for my interview. But before it goes to the end, I would like to ask, is there anything else that you would like to share about your experience when you are designing the blood glucose monitoring that we haven't covered?
So I think, honestly, I think CGM in general, it's a very much a breakthrough for healthcare providers. It's more, I would say it's more accurate. It's just give much more context than the finger sticks and the spot check itself. It's easier to execute and it's continuous and give a lot of context. So it's all good, and it's almost too good. Um, so that I would say we are gonna see more and more adoption in very near futures. And then also I would say a lot of times design can do a lot of things as I just shared, but also there's many things that's outside of design that is also critical to the patient experience. If we really talk about user experience as a whole, then you would think about, for example, the sensor design itself. Can it be less irritated to the skin? Can there be like waterproof and enough um, and really like comfortable to wear? That's, I think, pretty critical. It's like industrial design, right? That's still like a piece of stuff that will really touch your skin and become part of your body. I see many device manufacturers already doing great stuff. I think Dexcom, I think as a leader of this field, they are doing like really customization and like stickers to make the CGM sensor looks beautiful. It can be like, that plastic small stuff on your arm that really feels like a medical device, right? But a lot of companies, including, but really not limited to Dexcom, they give a lot of like really, I would say Gen Z kind of stickers that you can put it on so that you feel cool, energized, and it doesn't really look like a medical device anymore. Because I know their strategy is trying to tap into the younger generation, not just elderly patient who has diabetes. They want to be this they want the CGM to be a more general kind of a monitor device, just like Apple Watch. They want it to be a cool stuff, and people really can adopt them with or without any kind of diabetic symptoms. So that's what I said. CGM is really cool. It's really a breakthrough for the healthcare industry, and it's almost too good to a point that the manufacturers really want everyone to like it. And there's quite something that you can do on the sensor itself. And industrial design or even like graphic design is what I just said, right? Stickers, customizations, cool marketing materials, that's all gonna help the patient experience um, in a holistic view. And sometimes they're not even patients; they're just users. That's they can just pay out of pocket and from the shelf. So that's, I think, it's pretty cool business model, and design has a lot to do uh, in that space too.
Thank you so much for sharing about the different user groups and the different user experience nowadays with different manufacturers. So I guess that's all for the interview. Thanks for joining my conversation and hope you have a good day.
Bye.
Bye.